Welcome to Atrium Health Navicent Knows Health. Today my guest is Dr. Ojo. He is a board-certified orthopedic surgeon who specializes in foot and ankle, and today we're going to talk about his patients in Central Georgia. Dr. Ojo, thanks so much for being with me.
Thanks for having me.
Would you talk a little bit about the specialty training that you received to take care of both the ankle and the feet outside of regular orthopedic surgery?
So I did my residency in Augusta, and after completion of my residency program, I went down to Memphis at the Campbell Clinic, where I did a year's of specialty training, where we learned about all kind of pathologies in the foot and ankle and how to manage them, both surgically and non-surgically.
When it comes to the patients that you see routinely, there's a wide variety of those patients, but do they tend to be medical treatment of the foot and ankle or more surgical and injury treatment of the foot and ankle?
So I see patients of all ages and backgrounds, ranging from the older patients with arthritis in their ankle and foot, and even younger patients and athletes with traumatic injuries, playing basketball, playing around the yard with their friends. The treatment options that we offer the patient depends on what their diagnosis is and what they come in with. There are some injuries that multiple studies have shown that those patients benefit from surgery, and that's what I recommend for those patients. And there are also some other injuries that do very well without any surgery, with things like anti-inflammatories and rest and therapy, and occasionally we do even injections in the area that's affected, and those could be very effective as well.
So how do people do a self-assessment if they know if they've really hurt themselves?
So typically patients would, after an injury, they'll take anti-inflammatories, ice their ankle, and take a rest and take it easy for a couple of days. And if they're not doing better, that's when they typically will present to the office for me to evaluate them. And after evaluation, we'll get x-rays to evaluate the bony structures in the foot, see if they have any fractures. There are some injuries that don't show up on x-ray, ankle sprains and ligamentous injuries and tendon injuries don't show up on x-ray. And every once in a while you have to get advanced imaging like MRIs and things like that. But the treatment, again, that we offer those patients just depends on what they're coming with and what the diagnosis is.
When it comes to going to Ortho Georgia, and you mentioned about getting additional images, do you have an urgent care center that addresses both children and adults?
Yes, we have an urgent care center that's open Monday through Saturday, and we take care of all acute injuries, not only to the foot and ankle. I mean, pretty much any orthopedic injury can be taken care of by our urgent care staff. And
you also have in the sort of the continuum, or in all the things that go with the Ortho Georgia Center, you also have rehab as one of the pieces. Can you talk a little bit about if a patient needs rehab for their foot and ankle? What are some of the ways that that's done?
So after evaluation of the patient, again based on what the diagnosis is, if I believe that they would benefit from a skilled physical therapy, then we'll place a referral. And we have a number of physical therapists and even occupational therapists who are very well skilled and experienced who can help with the rehabilitation of the patient. Occasionally, for some other injuries, patients may not require skilled physical therapy. And in those situations, I put them on a home exercise program. I give them a handout and have them do some things at home.
When it comes to taking care of our health, a lot of times we don't really think about the foot and ankle. We're more worried about, the waistline and the muscles what would you tell patients before they become your patients about taking care of their feet and their ankles?
Oh, the foot and ankle is very important. If you have any kind of pathology or pain in your foot and ankle, I mean, you could be very miserable very quickly. So yes, it is vital to take care of your foot and ankle. And when I see patients in the office, those are the things we discuss. I counsel the patients on things to do, on shoe wears. If they're diabetic, we talk about diabetic foot care. So there are a host of things that we do discuss. Even patients are coming for an acute injury, we talk about a host of other things on how to take care of their foot and ankle so they can preserve function for long term.
When it came to picking out your profession, why did you choose medicine, and then why eventually orthopedics?
I've always wanted to be in medicine, just because I grew up with a lot of family members who were in medicine. So growing up, that was what I knew. And I picked orthopedics just because I enjoyed it. I enjoy fracture work, reconstruction, replacements, tendon injuries and repair. I specifically chose foot and ankle just because there is a variety of procedures and pathology and diseases in the foot and ankle. You never get bored doing one particular thing. A day in my office, I would see patients with fractures, patients with arthritis that need an ankle fusion or ankle replacement. We see sports injuries where you have to do, ankle arthroscopies, bunions, hammer toes. It's just the variety is what kind of drew me to foot and ankle.
And one last question for you. When we talk about fusions, that's a word that sometimes patients don't completely understand. I mean, that doesn't sound like something that you would want with a bone and maybe where a bone joined together. How would you explain a fusion and an ankle fusion, as you mentioned in your other answer? How would you explain that to a patient if that was what you were recommending for them?
So fusion procedures are typically reserved for arthritic joints or severe deformity, and it involves taking the joint and removing the cartilage in the joint and putting the bones together and stabilizing that with a screw or plate. And the idea is to get rid of that joint, which is typically what's causing the patient pain. The two bones grow together and become one. So it's it's commonly done in the ankle for ankle arthritis or even patients with severe flat foot that are very rigid. We occasionally would do what we call a hindfoot arthrodesis, which is just a medical term for fusing the bones in the ankle to correct the arch and actually give the patient an arch. We have another option now, which is an ankle replacement, which I also do for ankle arthritis, which is also a very good operation for pain control. Obviously, there are some indications, there are some criteria that you have to meet as a patient to be a candidate for an ankle replacement. But those are really the two options we have now for ankle arthritis.
Well, thank you so much for being with me today and telling me more about your practice.
Thank you. Thanks for having me.
And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Ojo and his practice, please visit us at atriumhealthnavicent.org.